Welcome back. April is Parkinson's Disease Awareness Month, and in this segment sponsored by Primary Care Plus, we are joined by Dr. Joseph Romito to discuss this condition that affects nearly 1 million Americans. Good morning.
Good morning.
Thank you so much for joining us.
It's a pleasure.
Well, you guys have said you've gotten a lot of interest from the community to learn more about this topic, especially with this month tying in to Parkinson's disease awareness. Just kind of go into a little bit about what is Parkinson's disease for people who may want to know more about it.
Absolutely. So Parkinson's disease is a movement disorder, a neurological movement disorder that causes a kind of slowing of the body. It's also associated with some tremors. It's an issue involving a tissue in the midbrain, so the direct center of the brain, that produces dopamine. And those cells can gradually die off and reduce the total amount of dopamine that the midbrain needs in order to coordinate how the body functions. And so Parkinson's can present with a variety of different kind of symptoms and progress over time. So what we do is, as primary care doctors, we look out for those symptoms. We want our patients to be on the lookout for movement symptoms, tremors of the hand, slowing of the body, a reduction in terms of how your face moves. It's sometimes referred to as a mask type face, where the muscles of the face don't move very well. And then you can even have more subtle symptoms, increasing depression and anxiety, sleep disturbances. Some people start having problems with their bowel and bladder. And that's a difficulty, is because that are also symptoms we associate sometimes with aging. And so it's an important thing where you need to talk with your doctor to be able to find that difference between normal aging or small problems with the body with aging and possible Parkinson's disease.
Right. Yeah, and you mentioned that aging. So what is primarily the age group that you would see kind of get affected by this disease?
Yeah, so Parkinson's we tend to see in the older population. The average onset age is about 60.
Okay.
It tends to affect men more often than women. In the cases where it is a woman affected by Parkinson's, it tends to be a little bit more rapidly progressing. So if a woman's developing Parkinson's, they might notice their symptoms worsening a little bit faster than a man would. And so that's why it's important to come in and see your primary care doctor if you're noticing those symptoms.
Yeah, I mean, actor Michael J. Fox has really been kind of an outspoken supporter, just really bringing awareness to the disease. And so what would you say, I guess the symptoms start in the early ages, sometimes they maybe change. Tell me a little bit about that.
So you might start with a small tremor of the hand.
Right.
That kind of starts affecting the thumb, a quick beating of the thumb.
Okay.
And you might start with a drop in how expressive your face is. You might not be smiling as large. You might be having a more drooped face. And those symptoms might progress over time. Some people start with the mental effects, the depression, the anxiety, the sleep disturbances. And so that can kind of progress over time. But the important thing is that if you speak with your doctor, you can get set up with a neurologist and get access to the medications and treatments that are effective for managing Parkinson's.
Right, right. So how can people find out more information about you guys? And then also maybe if you are at risk, what are some things that you can probably start doing now?
So you can go to our website at Primary Care Plus. There are some resources there. I would recommend speaking with your primary care provider if you don't have one. Definitely recommend getting one. Things you can do is, one, be on the lookout for these symptoms.
Right.
The earlier you catch the disease, the earlier you can get set up with the specialists you need, get access to the medicines you need, and have more good days with this disease and find yourself enjoying your life for a much longer period of time than struggling with some of these symptoms that might not be getting treated the way they need to be if you actually have underlying Parkinson's that's causing those symptoms.
Okay. Well, thank you so much for joining us. You always bring some really great information here on the show, so love having you.
Absolutely.
All right.
Thank you.